Welcome to the press briefing today. We have on stage 3 doctors, Dr. Edwin Choi, Controller of the Center for Health Protection, Dr. Chuang Shuk Kwan, Communicable Disease Branch, Center for Health Protection, and Dr. Lara Lee, Chief Manager, Hospital Authority. Now, Dr. Lee will give you an update on hospitality. Dr. Chuang will give you an update on number of cases, and then Dr. Edwin Choi will make some concluding remarks. First, Dr. Lee. Now, there are 2,941 patients in hospitals, 407 are new cases, 550 are in isolation facilities, isolation wards, 151 in first tier. Second tier isolation was 594 in Northland Tower Hospital, Hong Kong Infection Control Center, 263 in COVID-19 treatment center at AWE, and 290 of those in isolation facilities are new patients. 9 are in critical condition. 1 have 4 jabs, 2 free jabs, 4 2 jabs, and 2 have no vaccination records. 10 patients are in serious condition. Among the patients in hospital, there are in total 54 critically ill and 55 seriously ill patients. 14 are in ICUs. There are newly reported 9 death cases, 7 males and 2 females aged between 27 to 99. Among the 6 deceased, among the 9 deceased, 6 did not complete the 3 doses of vaccination. 2 were residential care home residents. Among the 9 deceased patients, 7 deaths were related to COVID. 2 may not be related, or there's a suspicion. Now I'll go through the cases. 78-year-old male, know that he had a clinical disease. He was admitted by the Yan Chai Hospital. He had shortness of breath and fever. Pneumonia was found, and then his condition continued to worsen. He passed away on the 4th. Second, 90-year-old male. He had 3 doses of vaccination. He was admitted by the Rottenji Hospital A&E department. His RAT test was positive. PCR test was also positive, and then he passed away on the 5th. Third patient was 87-year male. He had a history of cancer and he had hypertension. He was admitted end August by the Princess Margaret Hospital, and then he had pneumonia, and then he passed away on the 5th of September. The 4th, 73-year-old female. She had 3 doses. She had dementia and diabetes. She was admitted by the Rottenji A&E department. She had shortness of breath, fever, and also pneumonia, and she passed away on the 5th of September. 5th patient, 33-year-old residential care home resident. He had 3 doses of vaccine. He had sclerosis. He was admitted by the Queen Elizabeth A&E department. He had fever, and then he tested positive, and then his condition worsened. He passed away on the 5th of September. Then 6th patient, 99-year-old male. He had 2 doses of vaccine. He had heart disease. He was admitted by the Yan Chai A&E department. He had fever and shortness of breath, and then X-ray showed he had pneumonia. He passed away on the 5th of September. The 7th patient, 88-year-old female, she had 2 doses of vaccine. She had cardiac disease and diabetes. He was admitted by the United Christian Hospital. And then X-ray showed her she had pneumonia. Her condition worsened after being hospitalized. She passed away on the 5th of September. The 8th patient, we believe his death had nothing to do with COVID. 87-year-old male, he was admitted by the Queen Elizabeth. Brain scan showed he had brain hemorrhage. He was admitted to the surgical ward. He passed away on the 5th of September. The last patient, we're not sure if his death related to COVID. 27-year-old male with 2 doses of vaccine. He was bedridden, and he had different chronic diseases. He was found unconscious at home, and he was admitted by the Chunkano A&E department. RAT test was positive after resuscitation. His pulse revived, and then PCR test also was positive. But then he passed away on the 5th of September. In the past days, 369 patients recovered, 29 patients were discharged, 10 patients tested positive upon hospital admission screening, and 29 patients listed at close contact. 243 staff members became infected, 210 staff members returned to work. For Pamela Yo Nadaso Eastern Hospital, 7 doctors from the surgical ward confirmed patients from the 4th of September. 7 doctors, specialists in heart disease, found infected, but they did not attend social gathering together, but then they used the pantry in the ward at separate times. So we have investigated such investigation in terms of epidemiological links, and then the relevant department is still maintaining normal service, but we have suspended some of the non-emergency services. As for other heart specialist team in the hospital, they will be giving support and assistance. There's been disinfection. The hospital is now closely monitoring the situation. We're keeping close liaison with the Department of Health. That's all from me. Good afternoon. Yesterday, total number of new cases yesterday, 9,187. 2,418 PCR positive cases, 6,769 RAT positive cases. There are 186 imported cases. Of those, 169 are PCR positive cases and 17 RAT positive cases. Among the 186 imported cases, that includes 81 cases found at the airport. And then for cases found in days 1 to 3 at Horrington Hospital, 61, and then days 4 to 7 at the community level, 31 cases found, and then days 8 to 10 cases found at community testing stations, 13. So these cases came from 44 places, and 6 places imported more than 10 cases, 21 UK, 19 India, 16 the Philippines, Canada 15, USA and Thailand, 13 cases each. For the remaining 38 places, they imported a total of, less than 10 cases each. As mentioned, Dr. Lee said there are 9 death cases today. So for the 5th wave, the total number of death cases is 9,536. For residential care homes, there are a number of homes with cases. Some people have to be quarantined. Hong Fuk home for the elderly, 2 residents confirmed cases, 15 need to be quarantined. Yan Chai Hospital, Chi Man Gun home for the elderly, 1 resident is confirmed case, 2 needs to be quarantined. Hong Wei home for the elderly, 1 resident infected, 2 to be quarantined. And then another home, 1 infected, 9 needs to be quarantined. And then home, 1 resident infected, 1 to be quarantined. Kim Hak home for the elderly in Mong Kok, 1 infected, 5 quarantined. Hong Yan Yun 1 in Tuen Mun, 1 resident infected, 5 needs to be quarantined. For schools, 767 hot schools reported 1,516 cases today. 1,304 students and 212 teachers or teaching staff are infected. This 1,516 cases came from 187 kindergartens and nurseries, 280 primary schools, 280 secondary schools, and 15 special schools. In the past 7 days, 532 schools reported 2 cases or more. So we have recommended 45 schools to suspend 54 classes for 1 week. That includes 15 kindergartens and nurseries, 11 primary schools, 14 secondary schools, and 5 special schools. As for the details of the 45 schools, because the list is too long, I won't be giving you the names one by one. For the subvariants, today, on the 3rd of September, we received the positive samples ratio for BA 0.4 to 5 is 66%. Suspected BA 2.1, 6.6%. So it's similar to that for yesterday. So perhaps every day the figures may vary a bit. And then if we work out the ratio, then for BA5 is about 60%. The suspected cases, and suspected BA.4 cases about 6.6%. Suspected BA 2.1 cases about 6.6% too. The remaining is suspected BA 2.2 cases about 27%. So that's all from me today. Thank you.
Oh, Controller Trade, friends of the media, fellow citizens, I'd like to make it clear, as the cases or caseload is rising, we have received quite a lot of hotline inquiries. The CHP has received 140,000 calls through the hotline. I'd like to let the public know that we fully appreciate that with new measures like the vaccine pass measures, the members of the public would have a lot of questions. I'd like to make a few pleas. If people can have access to the online information, they should take full advantage of that. We do have a platform for the information. If they fail to get the information, we do have different hotlines at the moment, but there are a number of hotlines whereby people can make inquiries. Now, let me tell you the numbers first and supplement further information. That the CHP number 1830111, this number most familiar to the public. We do have different plans with different hotlines, and the HAD's hotline for stay home measure 1830 1833019, 1833019. If people need medical support, they can use the HA hotline 1836115, 1836115. If people report on the RAT platform, and if they experience difficulties, the number to call is 1836119, 1836119. This is an automatic system to register the positive cases. All you need to do when you call through is to register your ID number, and it will be calling you back. And you're welcome to call through 1836119. And the other one is regarding the change of the health code from red or amber to blue, or they have any general question about the code switch. We have a hotline from Audio. That's the Audio number. That's 2626 3066, 2626 3066. And we welcome the members of the public to call through the hotlines with the inquiries. Now, from the telephone inquiries, we get to understand that people are very concerned about the vaccine pass measures, and people would like to report old cases. Now, we are dealing with cases up to September. If the members of the public forgot to make the declaration, if they have any record dating back to August or a couple of months ago, they should not make the declaration via this platform. We will not be entertaining this. If the public fail to make any declaration, and if they have any concerns about the vaccine pass, I'd like to tell the public that the vaccines are really safe. 28 days after recovery, one can take the next jab. If one wants to fulfill the vaccine pass criteria, they should not be reporting the old infection cases. We will be improving the availability of information online. There will be FAQs to make available more information to the members of the public. So much I have to say by way of supplement. And I'd like to say a little bit about the monkeypox. Yesterday, we have received a report regarding a suspected monkeypox in this imported case. The patient has arrived at the quarantine hotel, and he developed some discomfort. He was sent to the A&E for further investigation and examination. And upon testing, this has been confirmed as a case of monkeypox, and this is PCR positive, and this has not found its way into the community. This is an imported case. Perhaps Dr. Chuang might wish to brief members on further details about the monkeypox, and I welcome questions that you may have from the floor. Right, this case is a 30-year-old male. On August 30th, he started having some rash on the skin, and this has extended to other parts of the body. On September 2nd, there is some lymph swelling, and he also developed some sore throat. He arrived at Hong Kong on September 5th from the Philippines, and he stayed in the Philippines from September 2nd to 5th, and he was previously in Canada, and he was also living in the States in early August 3rd till 25th. And from his contacts, there was nobody who was confirmed to have monkeypox or suspected to have monkeypox. He stayed in a Ramada Seaview Hotel, and he developed a sore throat and difficulty swallowing, and he called the hotline, and he was sent to the Queen Mary Hospital. And from the skin rash and blisters, they tested the PCR positive and confirmed to be monkeypox. We became aware of this case, and we conducted epidemiological tracing. He wasn't with anybody in Hong Kong, and we do have the COVID quarantine, and through a closed loop system, he was sent to the hotel from the airport, and he came on board PR300, and he was dressed in long sleeves and long pants all the way through, and he didn't have any contact with anybody else. And he's now is in isolation at the QMH. He did engage some high-risk activities overseas, and during that time, it is suspected that he was infected. We couldn't find any close contact. Now, this is the very first case in Hong Kong, so we have to tread carefully. Now, for those who came on board PR300 and the cabin crew, and those who took samples from him, and also those in the quarantine hotel, they may be kitted out in PPE, but we have reminded them to pay particular attention to their state of health. If they have any discomfort, they should come forward and seek medical attention. That they are not close contacts, but we like to exercise more precaution. Now, this is an imported case, and in accordance with our response plan, we will put Hong Kong on the alert level. We will be issuing the press release, and we'll be notifying the medical practitioners in Hong Kong to make them aware of the case. And if people suffer from these kind of symptoms, they should undergo testing. In the light of this case, we will be notifying the WHO, the mainland authorities, and the relevant health authorities. Thank you. It's now time for questions. Please raise your hands and wait for the mic to come along. And please identify the organization you represent. The last by one row, the gentleman in light blue. Cable news. Now, for the monkeypox case, Dr. Chuang, you mentioned that he did engage in some high-risk activities. What kind of activities? What are the nature of the activities? Now, on board the same flight, if they share the same toilet, would there be any risk of infection? And also the 7 cardiac doctors, how many wards did they attend to? How many people have they got in touch with? Did they go to the pantry on the same day? Now, for the school cases, we are looking at really exponential rise on a daily basis. If you don't suspend the class, can you protect the health of the children? Are there schools that experience more cases today? Right, let me address the question about monkeypox, and Dr. Chuang and Dr. Lee can supplement.
I'm sure you're all familiar with COVID, but then for the transmission channel for COVID and monkeypox is very different. For one, monkeypox is transmitted through very intimate, close contact, or skin, including skin contact. And then on the skin, there are probably, some media for transmission. The other channel of transmission is prolonged contact. So in our investigation, we did not identify any close contact in Hong Kong. As Dr. Chuang said, because this is the first case, we try to be very careful. So for anyone who's been on board of the flight or in a quarantine hotel or at the airport, if they had any contact with the patient, for example, staff who collected his specimen, we suggested they should monitor their own health condition very closely. But then we believe actually there's a very low risk of transmission through such contact, but still we want to play very safe. So far, we have not identified a close contact that needs to be quarantined. Perhaps Dr. Chuang could give you more information about the case now. For schools, there are over 40 schools with more than one class suspended. Four schools need to suspend more than one classes for 1 week. Well, there's a rise in cases in the community. As for schools, well, often these are cases identified by RAT, and so that means these cases did not actually go into the school, because it's only because there are more cases in the community. So by proportion, we are talking about some 690,000 students and over 100,000 teaching staff who've returned to the school. So it's quite a percentage of our population. So if we have about 1,000 cases a day, my ratio is not surprising. And the RAT test actually effectively prevent such positive cases from going into the schools. And then we will also see if there are a few cases in the same class. If that's the case, it's possible the transmission is through prior contact, but then it could just be in coincidence. But we want to play safe, so if there are a few students who test positive in the same class, and to play safe, we'll ask that class to be suspended for a week. We hope that these measures will help to prevent any major outbreaks in schools. For the 7 cardiologists, they were not at the pantry all at the same time. Starting from the 4th of September, they started to find that they became infected one by one. And now the pantry is in the center of that floor. So it's not because they work in a particular ward, but because they wear a proper personal protective gear, so others are not affected. Now, you asked about high-risk activities, but it involves personal information, so I'm not at liberty to divulge that. But if you read information from WHO, you know that the majority of them are male. The median age is 36 years old, and 95% involved man-to-man contact. Next, the one in beige. I'm from Phoenix TV. Are there any measures that the government will propose to prevent the spread of monkeypox in Hong Kong? If we have both COVID and monkeypox epidemic, what would happen and how would the government respond to that? It said earlier that monkeypox vaccine will soon arrive in Hong Kong. So when could you start allowing the public to take the vaccine? And it will be on a voluntary basis initially. Now, this morning, the chief executive said that the 0+7 option, it depends on the development of the epidemic. So what is meant by that? And, what is the progress in terms of implementing that plan? First, let me talk about monkeypox. Now, COVID has been around for some 2 years. And during that period, we do have other infectious diseases from time to time. For the importation of monkeypox cases, or it's highly likely. For example, this time is an imported case. because we have COVID measures in place. So for all arrivals at Hong Kong, they need to be quarantined. And this case did not go into the community because it was during the first day of quarantine that patient was admitted to hospital because he felt unwell. And after we learned that there were monkeypox cases overseas in Hong Kong, we started to make preparation. First, there will be, for our laboratories, we have already prepared the reference test. So that's why yesterday, as soon as we learned about the case, we could collect the specimen and then confirm it's a monkeypox case today after doing testing. Now, WHO has announced that we are still seeing new overseas monkeypox cases, especially in the USA and Europe, because there is international travel between Hong Kong and these places, so we cannot really prevent cases from being imported in Hong Kong. More importantly is how we could stop the spread of the disease in Hong Kong and minimize such spread. And for most monkeypox cases, we see that the majority of them involve male and in particular involving man-to-man sexual contact. So that's why we have to remind people, if you engage in any high-risk activities, you must have proper protection, especially if someone is suspected to have any infectious disease. Medical care must be sought at once to prevent the spread of the disease. For monkeypox and COVID, well, they're very different types of infectious diseases. Now, we want to protect the public from contracting COVID. For other infectious disease, there are also ways to protect the public. On vaccination, for monkeypox vaccine, we are now procuring the vaccine. We believe that it will arrive in Hong Kong in September. Now, the WHO's recommendation and international experience shows that monkeypox vaccine is not for everyone in the community. The first group would be the exposed groups. That means close contacts. Hopefully, with the vaccine, we could minimize spread of the disease. And the second group would be the high-risk groups as recommended by the WHO, that is medical staff, laboratory staff, or those engaging in high-risk activities, for example, those with man-to-man contact. So this will also help to prevent the spread of the disease through such high-risk activities. Now, once we have the vaccine, we will first administer the vaccine for all the close contacts, but in this case there are no close contacts, of course. And then secondly, for the reference high risk groups, we will talk to them to see how they would take the vaccination voluntarily as soon as possible. So the vaccination arrangement will be very different than that for COVID. Next, please. To the left, the last row, the one in black. I'm from Orange News. For this patient who has contracted monkeypox, what sort of condition is he in? What sort of treatment's been given to him? And then in responding to monkeypox, does a hospital authority have a plan? And if there should be an outbreak, do you have any contingency plan? A question for the CHP. It said that the vaccine will arrive in September. How many doses will we get in the first batch? And would the first batch be enough to meet the needs in Hong Kong? And then how often do people have to take this vaccine? And then do you have any facilities for the quarantining of close contacts of monkeypox patients? Would it lead to another major outbreak? Well, I think you've asked more than 10 questions. Perhaps I will ask Dr. Lee to tell you about the preparations made by the hospitals. Now, for, our infection control experts, when they learned about cases in the overseas, they already started making plans. In terms of hospital beds for such infectious diseases, we would not set aside beds for a particular disease. Rather, it's about the use of isolation beds. And that explains why, when it comes to the use of isolation beds, there is a demand from time to time. Also, we prepare the right medication. For that patient, he's in stable condition. There's need to do a series of tests on him. And if we go by our guidelines, if the patient is in a stable condition, there may be a need for any special medication. But if there are complications or his condition becomes serious, then we could administer certain medicine, for example, Sildenafil. Well, the hospital authority actually has stock of such medication.
Regarding the preparedness for monkeypox, as I said earlier, we do have different levels in our response plan. This is currently an alert level. Now, with the alert level, what we have to do is to monitor the situation to make sure that we will make preparation for imported cases and limit the spread of the disease. Now, monkeypox is not airborne disease. It is transmitted via bodily contact or close contact. So there are certain behaviors or measures that can limit the transmission. This is different from airborne transmission. If we find close contacts, we have to quarantine them. We have to make sure that there will not be any onset of the disease. The incubation period is a little bit longer for monkeypox. By international practice, there is a 21-day quarantine period. If we ever identify any close contacts, then there will be a quarantine period of 21 days. If we have identified the close contacts, we'll be working with the HA, and there will be a quarantine at the hospital, and then we will have the community facilities coming on stream. Next, the lady in white in the middle row, please. Hong Kong 01. Now, for the PYNEH, you mentioned the pantry, that's the cardiology section. Are there many doctors who have used it? Are you worried that the cluster will be spreading? There are 7 doctors that have come down with COVID. Would there be more? Would there be any samples taken from the pantry to ascertain whether there is any positive environmental sample? And the question about the monkeypox vaccines, how soon will they arrive in Hong Kong? How many doses? And you mentioned this will be administered on high-risk people. And how many people are we talking about? Will the ordered doses be anywhere near sufficient for that? And also, a doctor has been arrested in Yuen Long for issuing the vaccine exemption certificate appropriately. Will the DH be following up on this? Now, if people gain entrance to certain premises using these kind of a certificate, would there be any consequences? Right, about the pantry at the cardiology division, other than the 7 infected doctors, there are 5 more who have been to the pantry during that time, but they've all tested negative. For the pantry, the hospital will conduct investigation. I'm sure that they will collect environmental sampling, and certainly we will bring you up to date if we have further news. But basically, it was the cardiologists that they've been there. About the monkeypox vaccines, we already mentioned that a moment ago. The procurement work, we have completed the contract, and we are taking delivery. They should be arriving in Hong Kong by September. So basically, we're dealing with the post-exposure cases, the post-exposure close contacts. It all depends on how many imported cases and how many exposed people. In this case, there are no close contacts. Now, for post-exposure treatment, we don't really need to have vaccines. But we're not sure how the situation is going to be panning out because this is only an imported case. If we have to procure the vaccines, I'm sure that we have confidence we will be able to procure the right amount. As to pre-exposure use, that's in connection with the high-risk individuals, the healthcare workers, the lab workers. In theory, they are high-risk people. The healthcare workers have to deal with the communicable diseases, they are always wearing the PPE. But if there are any inadequacies and they need this kind of vaccination, the number of these cases would be small. But we will be dealing with the situation to identify who would be most suitable for the vaccination and who are the high-risk individuals who will be administered this kind of vaccine to minimize the risk. The police took action yesterday to deal with those who procured the vaccine exemption certificate by inappropriate means. I'd like to remind the public that this certificate is meant for those who are medically unfit for inoculation. We are facilitating them to comply with the vaccine pass requirement, but from the literature, from the relevant information, the vaccines are very safe. The number of people who are unfit for inoculation would be very small. If we identify anybody who resorted to inappropriate means to obtain this kind of certificate, they will be on the wrong side of the criminal law. And if they use a false instrument, the maximum penalty would be 14 years of custodial sentence. So people should not be on the wrong side of the law. They have to obtain the certificate in the right way. But criminal investigation is going on. We're not at liberty to supplement any further. Right? If I may supplement, the 5 cardiologists, they're not close contacts. Last row on the left, lady over there, please. Dr. Stevie B. Also on the monkeypox, the sufferer came to Hong Kong. There were some rashes on his skin. Why is it that he was allowed to board the vehicle to go to the hotel? Is because he concealed his health condition without making any declaration. When he went to on his way to the quarantine hotel, did he use designated vehicle or did he use taxi? Dr. Choi, you mentioned 21 day incubation period for monkeypox, and we need to rely on the quarantine hotel to identify these cases. That we are adopting these 3+4 protocol. Is it enough to guard against the importation of monkeypox? Right, let me explain this. We're not using this 3+4 protocol to guard against the importation of monkeypox. We cannot resort to the quarantine period in the hotel to guard against this kind of importation. But at least we do have the quarantine measures to make sure that anybody coming to Hong Kong will stay some time in the quarantine facilities. Now, in this case, he came to Hong Kong and he developed some discomfort on the first day. He didn't set foot in the community, and that's the beauty of the existing system. Now, with regard to the monkeypox, we do need to rely on the declaration on the part of the public. With the skin rashes, it would be hard for us to spot them, in particular if they are dressed in long sleeves. So when people are coming to Hong Kong, if they have any discomfort, they should let the staff know about it. And in the community, if anybody suspects that they are suffering from this communicable disease, they should seek medical attention. Perhaps Dr. Chong might wish to supplement on the situation. He went to the quarantine by a coach. He didn't have any fever at the time. He had some skin rashes in some concealed, hidden places, which are not visible. The lady in blue, please. Now TV. A 27-year-old deceased patient. Why do you conclude that this is not related to COVID infection? When was he infected? Was he infected at home? And I'd like to have more information, please, there. Dr. Choi, you mentioned yesterday 140,000 calls came through the hotline inquiring about the vaccine pass. Now, with are there more inquiries about the vaccine pass requirement for children at the age of 5. Will the CHP explain further how soon will the vaccine pass details be made known to the public?
Perhaps Dr. Lee could first respond. For the 27-year-old male deceased patient, he was bedridden and he had chronic diseases. He had mitochondrial disease. At the end of August, he was admitted via the Truncan Old Accident and Emergency Department. He passed out at home. Before that, he didn't have any signs of discomfort. And then we resuscitated him. His heartbeat resumed, but then he passed away on the 5th of November. And I said that we're not certain whether his death is related to COVID. We don't have enough information to make that assessment. Now, in the past few days, we received calls on the hotlines. People asked about asked various questions, and very often the inquiries were about trying to get an isolation order or quarantine order, or there's a need to convert the code, say from red to amber or from amber to blue and whatever. And that's why I said at the beginning that we fully appreciate that the public may have questions on the various measures. If we have enough information online to help you, then it will save you time to try to make the call. Of course, we know that some people may not know may not be used to searching online, but then there are various hotlines that I mentioned, and that will help you to make inquiries. And of course, when there are various measures launched, we could expect people to ask, more people asking questions about those measures. That's why recently there are more questions about the vaccine pass. And we find that many people actually wanted to give report of or declare their positive cases, that they didn't do so at the time. And as I said, now if people try to make the declaration afterwards, well, instead, would you consider whether the vaccine will help you? In that case, you should just get vaccinated, and you don't need to be worried, and you don't need to keep making such phone calls. Next, on the left, on the last row, the lady in blue. I'm from Mingpao. Good afternoon. First, about the monkeypox case. Just now, Dr. Chuang said that there are how many people there are in that group, and then the patient had a sore throat and also difficulty swallowing. How come it's related to monkeypox and not COVID? And what about the case of the patient? Do you need to administer the relevant medication? And then which vaccine are you buying? LC16 or LVCN? Now, you say you don't expect the need for many people to get vaccinated. So you say you help people get vaccinated, but is it before or after exposure? And then for the Eastern Hospital, how many doctors are there at the cardiology section there? What emergency services have been affected, and how many people do you have to redeploy to that section? Dr. Lee first. On the cardiology section, because there is a center for catheter, so that's why many cardiologists work there often. Now, there are 12 cardiologists who use that pantry. We have tested them all. 7 tested positive and 5 tested negative. As I said, as they did not go to social gatherings together, like having meals and taking off the mask, that's why they're not listed as close contacts. In other hospitals and in other clusters, we have support services. That's why emergency services have not been affected. But of course, if there is need for more support later on, we do have a mechanism in place. We have a central coordinating committee to deploy cardiologists to help out. You mentioned monkeypox. Well, for the patient, his condition is stable. We need to do more tests to decide whether we'll use that special medication. You asked a number of persons who may need vaccines or who need to pay attention. For that particular flight, PR 300, there are about 80 odd persons in quarantine hotels. And then we need to actually do an actual count on those who were at the hospital and those who are now in quarantine hotel. Now, on the 5th of September, he had sore throat, and going by the established procedure, he informed us of his symptoms, and we were suspected that he may have some sort of disease, so he was sent to the accident emergency department, and then there the examination showed that he was suspected to have contracted monkeypox, and that's why we're notified. The gentleman in the red t-shirt, please. I'm from AM730. About the monkeypox case, this 30-year-old male, is he a Hong Kong resident or is he a visitor? Now, you say you arrange for close contacts to get vaccinated. Will it be a mandatory or voluntary arrangement? What about hotel, handling his the bed sheets and other items in the hotel room? Are there any special guidelines to follow, or they just need to follow the infection control guidelines for COVID? Now, Dr. Choi said in the past few days you received yesterday you received 140,000 plus calls, but what about the usual number of calls each day? Was it a particularly busy day yesterday? How many staff members are there to answer calls? Could they cope? And now for the social distancing measures, they will almost expire soon. So do you have plans to announce new measures or tighten the existing measures? First, about calls, hotline calls. Now, in the past week, we could see that there are many calls. Every day, there are over 100,000 calls. That's the case in the past week. For the CHP hotline, it is manned by 100 staff members. But if there are many calls per hour, and if people have many questions to ask, of course, each call won't be too brief, and that means we've used up the full capacity of the hotline service, and other people couldn't call in. It's not desirable. Of course, if we deploy more staff to answer more calls, still we could not handle more than 100,000 calls a day. That's why we need to find other ways to disseminate the information to the public. And that's why I stressed earlier on that people could gain access to online information. We're also considering the use of information technology to help people find the answers they need easier. For example, Q&As, if they could get the information there, it would be useful. So we'll try to do that. Dr. Chuang. For that case, he holds a Hong Kong identity card. As for you mentioned the cleaning and disinfection of that hotel room. Well, the hotel should follow the standards of COVID, and that would be good enough. And so, for the beddings, you must not, wave them in any way. Otherwise, the germs may be disseminated. Next, please. Although we don't have any drugs or vaccines that we would compel people to use, but as there were cases that we may use vaccine or drugs for post-exposure treatment. That's firstly to reduce the chance of onset, and second to reduce community transmission or transmission through personal behavior. Next, the gentleman on to the left, second last row.
Doctor, some questions from the South China Morning Post. So the first question, again, about the monkeypox case. It was mentioned that the patient had been in 2 separate countries before, and he had these symptoms for a while already. Does the CHP know, or perhaps have an idea where he was infected? Was it the Philippines, or was it in the US, or the other country that was in? The second question, I wanted to ask a little bit about the with the recent cases about the the doctor that was arrested on suspicion of issuing false vaccine exemption certificates. The police have said they think the number is around 6,000. Are more documents being investigated by the government? Do you have an estimate on the number of these certificates that are affected or issued by this doctor? And also wanted to ask a bit more about the further plans on lowering extending the vaccine pass scheme to children aged between 5 to 11. Thank you.
Okay, so maybe I'll let Dr. Zhang respond to you about the investigation of the monkeypox case that we have conducted our epidemiological investigations, and that the patients has traveled to 3 countries before arriving in Hong Kong, and we noted there some high-risk exposure during his visit in one of the countries. So maybe Dr. Zhang, please.
Yeah, based on the date of onset of symptoms, incubation period, and high-risk activity, we suspect that based on this preliminary information, we suspect that the patient might have acquired the infection during his stay in the United States.
So for the case about the investigation of the medical exemption certificates that police department is conducting the investigation right now. So we don't have much to supplement, but later on we will issue a press release statement to remind public that they should get the formal documents in a proper manner instead of using illegal way to get any information. So for the vaccine pass, which we propose the age will be lowered to 5 years old, there will be some announcement later on this week, and I don't have any supplement at this moment. Okay, thank you. So it is quite difficult to screen out monkeypox in the airport, but we will surely enhance our health education and promotions and reminders to all inbound travelers that in case they have any symptoms suggestive of any kind of infectious disease, they have to report to our colleagues in the port health divisions, in the airport, or in other ground crossing boundaries. So it may help us to intercept any case of infectious disease as early as possible.
我哋答得最後一位，右手邊最後嗰行。
Last question, the lady in a black vest at the back, please. Economic Times. In terms of monkeypox, what are the discharge criteria? Are you going to be procuring any medication to tackle monkeypox? And what kind of vaccines will you procure and how many doses? And will this case be in any way affecting the discussion on the 0+7 protocol? And what about the non-emergency services that are affected? And the PYNEH, are there any patients that have been transferred to other hospitals? And also the vaccine pass for children, this will be lowered to the age of 5. Will the details be announced this week? And the Committee on Children's Rights expresses concern about the impact arising from that. The children might be left unattended at home, and the mental well-being of the children might also be affected as a result of this measure. Well, let me supplement a little bit first, and then I defer to Dr. Lee to let you know about the discharge criteria. Now, in relation to monkeypox, we attach a great deal of importance to that there is always a risk there for importation. So in terms of monkeypox, as I said in answer to some of the previous questions, if anybody coming to Hong Kong has any symptoms or any discomfort, they should tell us about it. We're not talking just about COVID. We adopt this measure for anything else in Hong Kong. If one is in a quarantine hotel or in the community, if there are any problems, any discomfort, the patient should report this to the healthcare authorities. the monkeypox doesn't have any direct link with the number of days for quarantine. There are so many other communicable diseases that we are worried about being imported into Hong Kong, not just monkeypox. So this doesn't have any link with the number of quarantine days. Now, for the vaccine pass, the key message we'd like to disseminate to the public and the parents is that the vaccines would be terribly important to protect children and senior citizens against COVID. The parents might have their own misgivings, and for a long time in the past, we would like to get hold of the medical team or the pediatrician to explain to the public how helpful these vaccines are to the children. If unvaccinated children get infected, the consequences will be very dire. So the vaccination will be very important. So we have to step up the awareness of the parents regarding vaccination. We hope that the parents would appreciate that the vaccines are very, very important. Dr. Lee, right about the monkeypox, we mentioned a moment ago that he was admitted to the hospital. We deal with the symptoms for serious cases. For complications, we have to prescribe the special medication, and we have to make sure that there will be no other bacterial infection. Now, in terms of discharge, it is a clinical decision, but we will look at the isolation, and we will be coordinating with the government in that regard. This is all the time we have for today. Thank you all very much. Right, for the emergency services, we will maintain these. We will maintain all the other services in the Hong Kong East cluster. The cardiologists and other hospitals will also help out if necessary. The Central Coordination Committee can also deploy cardiologists from other clusters to help out. Thank you all very much.